If you're a nurse practitioner student and statins still confuse you, this video is for you, okay? We'll be talking about the side effect of statins. Did someone come? No. Okay. Side effect of statins, drug interaction, when to use the high intensity statins versus the low intensity statins, okay? So, let's start. So, statins are one of the most prescribed medication in primary care, no doubt. And they are used to lower the cholesterol and reduce the risk of heart attack and the stroke, right? We all know that. Okay. Statins, how does it work? Statins work by blocking the HMG-CoA reductase in the liver, which decrease the cholesterol production and increase our LDL receptor activities. So that's how it lowers the cholesterol, okay? And the two main statins that you need to know are high intensity, low intensity, not low, like moderate intensity. Talk about high intensity now. High intensity statins lower LDL by 50%, and we have atorvastatin 40 to 80 milligrams and rovastatin 20 to 40 milligrams, okay? And moderate intensity statins, this lower LDL by like 30% or more. Examples are atorvastatin 10 to 20, rovastatin 5 to 10, simvastatin, pravastatin, lovastatin, okay? And when do we start statins? For secondary prevention, if your patient already had a heart attack, stroke, peripheral artery disease, or any known cardiovascular disease, they usually need statins. And most of the time with this condition, we use like high intensity statins, okay? And number two is our LDL. If their LDL is greater than or equal to like 190, then that's when we use like high intensity statins, okay? And number three is if they are diabetic from age 40 to 75, we have to use like at least moderate intensity statins, okay? If they're over 75, then we don't use like high intensity statins, okay? And four is like elevated AAS-CVD risk. If their 10-year cardiovascular risk is elevated, statins may be recommended even if their cholesterol doesn't look that terrible, okay? And the side effect that you need to know is like number one, muscle pain and muscle aches, malaise. But don't forget about the rhabdomyolysis, okay? On rhabdomyolysis, what are the symptoms? So they will have like severe muscle pain, weakness, dark urine, and on the lab, you'll see like elevated creatine kinase, CK level, okay? And out of all the statins, high dose simvastatin has like high risk of developing like rhabdomyolysis, okay? And we know that statins also elevate the liver enzymes. So if your patient develops jaundice, right upper quadrant pain, or severe fatigue, then think of liver injury. But draw baseline liver enzymes before you start them on high intensity statins or even like moderate intensity statins, okay? Yep. Okay, now let's talk about the drug interaction, okay? So we do not mix statins with grapefruit juice because it increases the risk of toxicity and rhabdomyolysis, okay? Especially with lovastatin, simvastatin, and atorvastatin, okay? Now let's talk about the medication. So be very careful when you're prescribing macrolides and the statins and antifungal like ketoconazole, fluconazole, okay? And this increase the statin levels and risk of rhabdomyolysis. And number third is fibrates like zemfibrozil plus statins, like higher risk of muscle toxicity. But fenofibrate is generally like safer combination if needed, okay? And calcium channel blockers like imidodrin. This can also increase statin concentration and pregnancy. Statins are generally avoided in pregnancy because cholesterol is important for fetal development, right? And what we need to monitor when they are on statins: number one, lipid panel, and liver enzymes. If you see any symptoms of liver injury, muscle symptoms like muscle pain, and CK like creatine kinase like for muscle pain, weakness, and all that, okay? I think that's about it with statins. Just remember all these tips and tricks, okay? Thank you. I'll see you in next video. Bye bye. Follow me. Yeah.